Good morning, Nashville. Yesterday, the 7-day daily average of new confirmed cases, this is nationwide, was 66,000. Now, that's an unacceptably high number, but it was the lowest it's been in the U.S. in 10 days. Now, Nashville appears to be following a hopeful trend right now, which may indicate signs of a slowdown in new cases. The efforts here and of many neighboring hotspot cities and states may be beginning to pay off. Now, these efforts have required 21 out of 50 states, including Arkansas, Mississippi, Alabama, South Carolina, and North Carolina, to pause or reverse their reopening plans. And 32 states, including Arkansas, Kentucky, Virginia, North Carolina, and Alabama, have implemented statewide mask ordinances after recognizing the importance of face coverings in slowing the spread of the virus. Now, joining the efforts in these other states, Nashville has both reversed our reopening plan by returning to a modified Phase 2 and implemented a county-wide mask ordinance. We've also implemented other public health orders intended to slow the spread of the coronavirus. Now, early indications confirmed by Vanderbilt researchers show that the new protocols adopted here and your dedication to following them are working in Davidson County, as they are working in other cities and states that have adopted them. Nashville remains in serious but stable condition. As of this morning, our 14-day new case rolling average has moved from red to yellow. On July the 4th, this metric was 397. Today, our case average is 342, which is still below satisfactory, but an improvement from its previous rate. And our transmission rate 2 weeks ago was in the red at above 1.2. It is now green at 0.99. And Nashville's 7-day positivity rate is at 13.3%, down from 18.5% 2 weeks ago. Let me be clear, the difficult work of responding to the coronavirus still lies ahead. We are on a trail that can lead us out of the wilderness, but we are still deep in the woods. One wrong move, one brief moment of distraction, and we will lose our bearings. We must hold on to the progress we've made, which is why we will remain in a modified Phase 2 for the time being. All other restrictions, including a temporary closure of all bars, limited service restaurants, and transportainment vehicles, and the 10 p.m. closure of all restaurants in Davidson County, will be extended at least until midnight on the evening of August the 16th. Public Health Order 9 will be further amended and announced later this week. Now, yesterday, Dr. Deborah Birx, the White House Coronavirus Response Coordinator, visited Tennessee, one of the 18 hotspots identified by the White House nationwide, to share what the federal government has learned about the virus and what is working to slow its spread. Dr. Birx particularly warned of residents under age 30 becoming vectors for the disease and of surging cases among rural communities, both of which we are seeing here in Tennessee. In the first week of July, Nashville accounted for an average of 27% of the daily new cases of COVID-19 in Tennessee. That number has shrunk to just 15.5%, as 88 out of all 95 counties are above the state's threshold for acceptable virus transmission. Dr. Birx strongly warned that based on their findings, mask mandates, bar closures, and social distancing measures must be in place statewide to mitigate the spread of the virus. Now, as a healthcare hub for the entire region, Nashville's healthcare capacity is vulnerable to rural counties that do not require masks or adopt public health protocols to keep their residents safe. We will continue to insist on a coordinated response based on what we know has worked for other countries and other states to help stem the tide of the coronavirus and save lives. Recently, I spoke with mayors from the other big four cities in Tennessee, Memphis, Knoxville, and Chattanooga, about the specific problem of delayed test results. We've communicated our concerns to the state along with several ideas to improve the expediency of test results statewide, including the implementation of pool testing where appropriate, and using the state's CARES Act funds to incentivize more timely delivery of test results. Timely delivery will help improve our testing effectiveness. Remember, Nashville, don't share your air. If 8 out of 10 Nashville wear a mask, we can avoid further shutdown and fully reopen our economy without interruption. As long as our school children cannot attend classes in person for fear of falling ill to the virus or transmitting it to their loved ones, all of us have a long way to go to improve the public health condition of our city. Metro Public Health has distributed more than 287,000 free masks, 90,000 of which are distributed through our community partners, including Conexión Americas, the Islamic Center of Tennessee, and the Ethiopian Community Association. You can receive a free mask by visiting the Lentz Public Health Center Monday through Friday from 9 a.m. until 3 p.m. Recent storms damaged our community assessment center located at 2491 Murfreesboro Pike in Antioch. This site will be closed today for repairs and is anticipated to be reopened tomorrow. In the meantime, you can receive a free diagnostic test at one of Metro's 2 other assessment centers, at Nissan Stadium Lot N or at Meharry Medical College, located at 918 21st Avenue North. Visit covid19.nashville.gov for more details. In Nashville's modified Phase 2, businesses that were identified as sources of infection, including bars and restaurants, were either temporarily closed or moved back to Phase 1 capacities. The majority of other small businesses in Davidson County are open at either Phase 2 or Phase 3 levels with proper public health protocols in place to keep workers and customers safe. They are doing the right thing to protect our community, and they are counting on others to help them keep their doors open and their staff employed. Now, this morning, it's my pleasure to welcome Moselle Martin, who with his wife, Aretha Martin, own Martin's Chicken and Waffles in Goodlettsville. He is here this morning to discuss his challenges as a small business owner and entrepreneur, and to appeal to all Nashvillians about the urgency to practice healthy habits to keep our economy running. And Bill Miller, owner of the Icon Entertainment Group, was scheduled to be here this morning but will not be able to join us due to an emergency. Icon's efforts are reflected in the iconic billboard of Johnny Cash himself, wearing a mask to inspire friends, family, and fans to stay safe. And it is a new symbol for Nashville in these challenging times. We can draw on our past and our humor, and we can adapt. I'll turn it over now to Dr. Alice Shahanger, Chair of the Metro Coronavirus Task Force.
Thank you, Mayor Cooper, and good morning, Nashville. Here's the latest on coronavirus in Davidson County. We now have 20,488 confirmed cases. That's 363 new cases in the past 24 hours. There are currently 5,341 active cases. While this is the lowest number we have seen in 2 weeks, it still is double the number of where we were last month. 73% of all confirmed cases, or 15,000 residents, have now recovered. Since our update on Thursday, 19 Nashvillians have died because of confirmed cases of COVID-19. 180 Nashvillians have now died because of confirmed COVID-19, and the mortality rate for our city is at 0.9%. We continue to monitor our hospitals, and this morning, 18% of floor beds and 12% of ICU beds are available. Our rolling average is 342 new cases per day. That's down 21 cases since last Thursday. The average has stabilized over the past 2 weeks. Now, while it is stable, this is still a very high new number of cases. In fact, it's double the number of new cases from 1 month ago when there were 172 cases on average per day. The 7-day positivity rate, or the percentage of people who have tested positive over this past week, is at 13.3%. Ideally, we want the positivity rate 10% or less. Our rate is above the threshold, but it is improving. It was at its highest at 18.5% on July 15th. And has been declining ever since. Finally, our transmission rate is just under 1 this morning.